Okay.
Yeah, continue.
Okay. So the ropes and belts, and we are using the, we are tying the ropes and belts with a little bit of pressure, and this helps to stretch the muscles. And they also, the when I was talking about the cervical spondylosis, the lumbar spondylosis, it helps in bringing the curvature of the spine back in shape because of the technique. It's a technique, it's a skill. Tying of the ropes and belts is actually a skill which has to be practiced and it has to be mastered. And the particular way in which it is tied, it helps in correcting the musculoskeletal system. Likewise, for the osteoarthritis of the knee joint, again, the way the ropes and belts, the ropes and belts are used in conjunction with each other. So the way they are tied, it helps in correcting the weight bearing axis of the body. And because of the disturbance of the weight bearing axis, people get into, or the weight bearing axis is disturbed and people have osteoarthritis of the knee joint. So again, these are corrective measures, and using ropes and belts, it gives a lot of pressure. uh, I have had experience, and I have got very good experience with my patients, even when I was a student working at, studying at Unnati Center, which is at Pune, and even independently when I have been practicing on my own. I have seen a lot of quick relief amongst the patients. So this therapy is definitely something new, and it is definitely very effective. And typically, we request patients to come for up to minimum 2 to 3 months to take this therapy, and they have to come every day because this is yoga therapy. So they have to come every day. And in my practice in Pune, I used to also conduct meditations, pranayam, the correct way of breathing. So those also were included, the chanting of Omkar, the chanting of Gayatri mantra. So all these has also been incorporated. This is how we have studied at Unnati Yoga Therapy Center. Now, I would like to relate some examples, of some patients, because one is we're talking about the therapy, because therapy you will have to see some slides. So, sir, can we have some slides, please? So
Yeah, it
that,
is. You can tell about myself.
uh, no, can we show them something? Do you have something to show them right now?
Yeah. I'll take one by one. Okay, I got many slides.
Yeah. Yeah. Because, because it will be easier
Yeah, you
people
can
to relate.
see.
Yeah. Your screen is visible. Yeah.
Yeah, yeah, you can see. Everybody visible, no? No?
Yes, sir. Sir, your screen is definitely visible, but you have to open the file.
Okay.
Your screen is definitely visible. The file is not yet opened. I think it's a JPEG file.
Now, okay. Now you can see.
Uh, yes.
Yeah.
Yes, now your screen is visible. So this is, again, we are using two ropes. We are using two ropes here. And this is for kyphosis. So this is for patients with cervical spondylosis. So this is one of the postures that is given for people with cervical spondylosis, and also for people who are having kyphosis. So using the ropes, so there are two ropes that are used in a particular way, and this is actually called, this particular sequence is called rope jacket, because we literally make a jacket out of the ropes and wear the rope as though I'm wearing a jacket. So this is called a rope jacket, and this is a very important uh, posture given for cervical spondylosis, where if you see the hands, the shoulders are going back. So there is a retraction of the scapula. The scapula is getting retracted, and and there are three positions in this. So we give each position for three minutes, and the total 9 minutes for this particular sequence. May we have the next slide, please?
2 times it again. Yeah.
Yeah. So,
Yeah. Able to see
so
now?
which one is this? I'm trying to figure out.
Yeah, this is at the back. Tying up from the back near the cervical part to the
Okay, you're lying down, or what is this?
lying down. Yeah.
You're lying down. Okay, so just to take the picture of this. Okay.
This is my head. This is the head. Yeah. You can explain.
Yeah. Okay. So this is again for cervical spondylosis. This will help correct the curvature of the cervical spine. So again, there are only belts used here. There are no ropes. So there are no ropes in this particular sequence. So belts are used tied in a particular way. The tying of the belt is very important, and this helps gives the effect of a traction.
But there is no cervical problem for me. Just for a demonstration purpose, we have done it. Okay.
Yeah. Next slide, please.
Yeah. 1 minute.
Sir,
One
you'll
minute.
have to go to the next one.
Yeah, no, 1 minute. I have to arrange it.
Yeah.
Sorry.
Sir, is there a way to scroll? You should have some arrow where you can go to the next picture without having to come out of it.
So 1 minute. I'll just.
Yeah. Can you do a right click? I'll help you. Sir, do a right click on the file. I'll help you.
1 minute.
Go to the screen.
Yeah, share the screen. Yeah. Right click.
So just do a right click and there will be some options open with. Can you share your screen, sir? So please share your screen.
This is screen. I shared already.
No, please close this file. Please close this file.
Yeah.
Yeah, please share your screen now.
Yeah, here it is.
No, you have to share your screen, sir.
Okay, you want me to share the screen? Each and every it will
Yes,
take
please.
a lot of time, madam, because there are so many files are there.
Sir, I'm trying to help you with a shortcut. So allow me to show you a shortcut in using a computer. So I'll show you a shortcut way of opening the files. So it will be easier.
Okay.
Can you go to your share your screen, please?
Yes. Screen is already open. Yeah.
No, sir. You have to share your screen. I'm not able to see your screen.
1 minute.
You have to share your screen.
That's over. Yeah. Now I'll get it. Yeah.
Sir, are you? Yeah. Okay. Okay. So this is, sir, it is not very clear in this picture. So only the belts are visible. The ropes are not visible out here. Is there a way for you to go to the next picture? Can you go to the next? Sir, before you open the file, can you share your screen? I'll tell you how to open the file.
1 minute.
Sir, please don't open the file. Just share your screen without opening any pictures.
Okay, share the screen. Okay. Then.
No, I am not able to see your screen, sir.
Okay. This you can see.
Yeah, please close this file.
I'll close this. Okay.
Yeah, I want you to go to Windows Explorer.
Windows.
Yeah, please close this picture, sir. So I think we can go, sir, picture by picture as you've been showing. I think that will be better. It's
Yeah.
okay. We'll have to go to the next slide,
Yeah.
the next picture. So please share your screen.
Sorry.
Yeah.
ये भी front view हो गया. We shall do.
Yeah, okay. So I think only the ropes are visible at the end, but it is not clear which particular posture this is. But this is just to give an idea. This is a case of a osteoarthritis of the knee joint patient who's sitting in Dandasana. And this is a combination of ropes and belts. The ropes are in a particular way. It is not visible in this particular picture. And these help in this particular condition. Maybe we'll try to go to the next picture, sir, so that it will be more clear. This one is not giving a clear picture.
Here it is. Okay. On the lateral, this is on the lateral view.
Yeah.
Belts are tied at the back.
This is again a lateral view.
Ah.
Belts are tied. There are two white belts. And I would also like to bring everyone's notice. Can you please note the green belts on the tied to the thigh of four green belts on, sir? Please make a note of 4 green belts. Now, these are additional belts that a patient is required to tie throughout the day or whenever possible. So these green belts, there are 4 in numbers, and there is one tied 3 inches above the kneecap, and there is another green belt which is tied 3 inches below the kneecap. These are called knee mobilizers. So these green belts are called knee mobilizers. They help mobilize the knee joint.
It stimulates the mobilization.
So we request patients, so we request patients to wear these green belts who have to do a lot of walking, who have to do a lot of climbing of stairs. And there are some patients in some cases where they say, I need to sit cross-legged. And the first thing that we tell any patient is, please do not climb staircases, please do not walk a lot, please do not sit to Sukhasana. But then there are patients, because of a particular lifestyle, they are forced to do all these activities. So then these belts, they support the patient's knee. So they are called knee mobilizers. And there is a particular in which the green belts, the knee mobilizers are tied. The green belts, the upper part of the green belts, which are 3 inches above the kneecap, help in lateral rotation of the knee joint. And the 2 belts, which are tied 3 inches below the knee joint, help in medial rotation of the knee joint. So this belts the patient has to wear, learn how to wear and tie these belts on their own, and use it throughout the day. And in case of a knee bow, if there are many people with a knee bow legs. So these belts, the way it is, like I said, the belts which are 3 inches below the kneecap, they help in medial rotation of the knee joint. So they help in the correction of the knee bow. So the shape of the knee is also corrected with the help of this green belt, which a patient is required to wear throughout the day. And it helps in a patient to walk in spite of their condition. It helps them walk. It helps them in sitting in Sukhasana, although that is contraindicated. But in extreme cases where a patient, there was a lady when I was a student, so she was a vegetable vendor. So she was forced to sit cross-legged, sitting, and selling vegetables. So for such patients, the green belt definitely helps, and also in walking. So the green belts helps them carry out their daily activities and also manage the pain at the same time. And the ropes are also tied. Again, it is not clear the way the rope is tied. So I think, sir, we can go to the next picture.
Rock is kept in between both the legs. Here you can see the at the extreme end. So you get the alignment also.
Yeah, we get the alignment. Again, it helps in correcting the weight bearing axis of the knee joint, and the ropes also additionally help in medial rotation of the knee joint.
Okay.
And they also help in the eversion action.
Okay.
So it helps in the foot is corrected, helps in the eversion action. It also helps in stretching the calf muscles. A lot of stretch. Now, the way the rope is tied is not very clear here, but I will just like to add that the way the ropes are tied and along with the belt, it helps in stretching the muscles. And the stretch is tremendous. The stretch is tremendous. What I will achieve without the ropes and belts, I can achieve much more with the help of ropes and belts. It gives a tremendous stretch, and we just keep this posture for 10 minutes. Maximum 10 minutes is what we give to the patient, and in 10 minutes time you get a tremendous stretch to the calf muscles. The calf muscles are stretched, and also it helps in stretching the
Hamstring.
hamstring,
Hamstring.
and also the heel stretch. So even for Achilles heels, so there are some people who come with a bone spur, calcaneum spur. So it also helps in stretching the Achilles tendon, and also the medial rotation of the knee joint. All these are achieved. So can you go to the next picture, please? Sir, do you have a picture of the white? There are another belt, since you're talking about the knee. We'll also talk about the white belt, which is not visible here. Yeah, so this is more clear. So this one is called a double knot foot stretch. There are two knots on the rope, and this helps in giving an eversion action to the foot. Because in knee patients, the foot is turned, it is inverted. So we get an eversion action using this particular technique of tying the rope. So it helps in bringing correcting the posture of the both the feet, and the action is eversion. So this is called double knot foot stretch, and these ropes are connected to the belts that are around the patient's waist. And with this action, the eversion. So again, like I said, I'm not getting into the anatomy, but it helps in correcting the weight bearing axis. So it gives an eversion action. So if I'm having my feet like this, it helps them to turn the feet outward, because generally in knee patients the feet become like this. So I'm actually trying to make the feet like this. So that action happens, and there are many people with flat feet. So this also helps in correcting the flat feet of patients. And with the ropes, it is important that it is tied with a lot of pressure. So we actually have to use muscle strength to tie the ropes and belts. And because of that, it gives a tremendous stretch, a tremendous pull to the muscles that are needed to help knee patients. Yeah, if anybody has any question, they can unmute and ask them questions. Otherwise, we can move to the next picture.
Yeah.
Yeah. Else we can move to the next picture, please. Now, so far we have seen postures for cervical spondylosis and osteoarthritis of the knee joint. I think we don't have any pictures right now with for lumbar spondylosis. But again, lumbar spondylosis is a very intensive program.
No. No, it is not there, madam.
It is not there. Okay, all right. Okay.
Sir has not come. You are supposed to come anyway. Chalo, theek hai. Now, what I am doing
Okay.
at home, whatever the asanas you are doing, that you are modified asanas, whatever I am doing, you have to show. Okay. First is Tadasana.
Tadasana. Yes, sir.
All are able to see me?
No, sir.
Marvel?
I cannot see you.
Huh?
I cannot see you. I cannot see you.
1 minute.
Sir,
Yeah.
you have to go behind and switch on the light, sir. You have to go behind, far away from the camera. And switch on the light.
Now it is okay.
Yeah.
Light is on only at the side and the back. Yeah.
So these are the at-home yogasanas, which a patient is supposed to do at home. And our recommendation is 3 times in a day at home.
You have to specify what are the modified asanas. Huh? Because people are all aware
Okay.
of Tadasana, Triyang Tadasana and all. But modified asana, you have to.
Okay. Okay. So the first one is Tadasana. Now in Tadasana here, we are not going to lift the heel. The feet will be flat on the floor. Distance between the legs as much as the shoulders. And then, sir, I'm going to give you the instructions. Tighten the kneecaps, squeeze the buttock muscles, suck in the abdomen, lift the rib cage up. Hands, lift the hands from the sides up above the head. Shoulders relaxed. And breathing is normal breathing. And the feet, become aware of the posture, become aware of the feet. The feet are flat on the floor. Become aware of the big toe, the little toe, and the heel. The entire foot on the floor. So this Tadasana, now one of the main reasons for people, we ask a lot of, I've also asked my patients when they come, what is your, how are you walking, how are you practicing, standing? And many people, they give an idea of how they've been, they tend to stand on one leg for a lot of time, for whatever reason. Maybe they were traveling in a bus or something. So we are not, people are not standing with awareness. So most of the time, the weight is only on one entire leg. So this Tadasana helps to correct our posture. This is the correct way of standing, where the entire feet is on the floor.
Sangeetha, you have to tell how it is different from the ordinary asana. Because you have told us squeezing the buttocks, tighten the kneecap, that is strengthen the knee.
Yes. Yeah. So what happens is, sir, can you turn laterally, turn, yeah. So the feet are on the floor, you're tightening the kneecaps because you're working on the knee. Now you're squeezing the buttock muscles and you're sucking the abdomen. When you squeeze the buttock muscle, suck in the abdomen, you are doing extension of the pelvis. The pelvis again is in a flexion position. So we are trying to extend the pelvis. So then we are trying to squeeze the buttock muscle, suck in the abdomen. And whenever you have an increased lordosis, this and lifting of the rib cage, it helps to straighten the spine. So you suck in your abdomen, lift the rib cage, and you'll be able to actually visually, you can, people also can try this at home in front of a mirror. You suck in the abdomen, lift the rib cage, your spine becomes straight. And then you're giving an upward traction when you lift your hands up. So you're just trying to stretch the spine. So you're straightening the spine and you're trying to stretch it. So you're trying to increase the gap between the spine. So this helps in correcting the entire. So this is a very, because cervical spondylosis, lumbar spondylosis, osteoarthritis of the knee joint is mainly occurring because of posture. It is because of the way the person is standing, the way the person is sitting. And Tadasana helps correct our posture. So at least we say entire day, we will not probably ask the person to suck in the abdomen, lift the rib cage. But whenever we stand, wherever we stand, it is important to make sure that we are with awareness. The entire feet, left foot, right foot are entirely on the floor, and the weight of the body. And also I ask the patient to feel the weight of the body. It is equally on both the hip joints, it is equally on both the knee joints, and it is equally on both the ankle joints. So in Tadasana, once you stand in Tadasana, you have to feel the weight of the body being equally distributed between both the hip joints, both the knee joints, both the ankle joints. So Tadasana is a posture we have to adopt the entire day. And when we ask him to do at home, that is the only time when you squeeze the kneecaps, tighten the kneecaps, squeeze the buttock muscle, suck in abdomen, lift the rib cage. So that is only when you're doing the exercise. But entire day the posture should be Tadasana. Feet firmly on the floor and weight of the body equally distributed between both hip joints, both knee joints, both the ankle joints. Okay. Sir, next, can you get modified Virabhadrasana? Yeah, in modified Virabhadrasana, now sir is standing in the middle of the room. Ideally, he has
1 minute.
modified Virabhadrasana, yeah.
Or everybody knows.
Yeah, modified, hands on the hips, hands on the hips.
Yeah, because of the knee problem, knee has not to be bent under any condition.
Yes.
First I did like an ordinary asana. Now they modified Virabhadrasana. Okay.
Modified Virabhadrasana. This is for knee patients. In modified Virabhadrasana, the left foot should be against the wall. Now, sir is standing in the middle of the room because he's trying to demonstrate. But now his right leg is in front, left leg is behind. Is that correct, sir?
Yeah, correct.
Left leg is behind. Yeah, left leg is behind, right leg is in. The left leg should be supported with the wall. You have to make sure that the left leg, you're taking the support of a wall. This is just because most of the knee patients are senior citizens and we want them to make sure that they are able to maintain their balance. So for that reason, the left foot will be touching the wall.
Left
leg, right leg will be straight. They will not be bent. And the distance right leg, as much as a patient can, they have to take the right leg in front, hands on the hips, normal breathing, and count up to 10. Hold this posture for 10 counts only. And this gives a stretch. The hamstring of the left leg gives a very nice stretch. And also quadriceps of the right leg. So the quadriceps of both the legs get a nice stretch, and the hamstring of both the legs, especially the leg behind, the left leg, gets a very nice stretch because it is very important to stretch the calf and the hamstring. So we work on stretching the calf muscles and hamstring. The next, we ask the person to change the leg position. The leg, left leg in the front, right leg behind. Again, the right leg should be touching the wall. The right foot should be touching the wall. So we are taking support of the wall. Hands on the hips. Legs will be straight. Spread the legs back and forth as much as the patient is able to. Hold this for 10 counts with a normal breathing, no holding of breath, and feel the stretch. This again helps to stretch the quadriceps, the hamstring, and to some extent the calf muscles. So the leg muscles get a nice stretch in this. So this is modified Virabhadrasana. Okay. Then next is the heel stretch with the use of a brick.
Now not wooden brick is there, but I am using teapot. Teapot का नीचे का भाग मैं use कर रहा हूँ, नीचे का भाग. Okay, just touching the wall.
Okay.
You can just see my legs. Yes.
Okay. Yeah. Now your legs are visible. So next is the heel stretch. We use a brick. In case of brick, is using there's an alternate way. So in this, I will just explain all the toes of the left foot and the right foot are on the brick, and the heel is on the floor. The back will be straight because while doing this, we have to make sure that the people does not develop low back pain. So the posture is very important. The patient has to stand straight, heels on the floor, and all the toes of both the legs have to be raised on a raised surface, ideally a brick. This gives a tremendous, and this stretch is a wonderful stretch for the calf muscles. Now, there was once I was at a store, and there was a Pani Puri wala standing. I was standing at I think there was a tailor, and I was standing talking to her. And that lady was complaining of knee pain. And then this Pani Puri wala was also there. And he was also complaining, he has to stand whole day and I have a lot of pain. And there was a paver block, the paver blocks on the road. So there was a paver block, and I quickly asked him to do this heel stretch. And that tailor, that lady also, I said, you also do this heel stretch. I quickly taught them this heel stretch. I said, there is this block that is lying, just make use of it. And they enjoyed that stretch because it gives a beautiful stretch to your calf muscles. It gives a wonderful stretch to your calf muscles. And once the calf muscles are stretched, the pain in the calf muscles disappears. They really loved it. I actually asked them to do it for a very short interval. But after they did it, I saw their expression. They said it is wonderful. So anybody with knee pain, whether they have osteoarthritis of the knee joint or not, they love the heel stretch. But it has to be learned in a proper way. But we're just giving a quick introduction so that people get introduced to these concepts. But when you learn it and you do it perfectly, it is a wonderful stretch. Yeah.
How I am using the rope belt at my home because of the corona, I'm not able to go.
Yeah.
To go to Borivali at Prana Yoga Center. So and they have taught me this alternative system.
Yeah, and so what about the Padangushtasan?
Acha, by right or no?
Yeah, can you demonstrate Padangushtasan? Is it possible for you to demonstrate Padangushtasan? With the help of a rope, with a belt?
With the belt, it is tied up.
Okay, so okay, you can do it. We can.
Tie the belt in my leg. One leg, two legs, and both the legs. Okay,
both
please.
the legs. Yeah.
That here.
No, you can do the resting, sir. So you can do the Padangushtasan resting, putting the legs against. You can put it against the cupboard.
Against the cupboard. Okay.
Yeah. Yeah, but you're not supposed to sit on the floor. Ideally, you're supposed to do it on a bed. But I will leave it to you. Okay, I will explain, sir. You're not allowed to sit.
I can do it, huh?
Okay, all right. So this is the Padangushtasan, and this is a resting posture. And ideally, the buttock should be touching the wall. This is against the cupboard, so the buttock should be touching the wall. So this is Padangushtasan. This is the resting posture. So the body is in the shape of L. This gives an excellent rest to the lumbar part. The lumbar region is nicely rested, and ideal position, the buttocks should be touching the wall. And sir is actually supposed to do it on the bed, not on the floor. That's fine. And the legs are rested. So this you can safely do for up to maximum 10 minutes. And this also we recommend patients to do it for 3 times in a day, 10 minutes each. This is a resting posture, and this helps. There are many benefits to this, but this helps a knee patient because it is helping the venous return. So then this is the inversion of the legs, and the lumbar region is rested. So this we recommend this to every knee patient and every patient with lumbar spondylosis.
Ma'am, I have a question.
Yes.
Why he cannot do it on the floor? Why he has to do it on the bed?
He's a knee patient. He's not supposed to bend his knee and sit on the floor.
But otherwise, people can do on the ground by.
See, the knee patient, first thing when they come to us, we tell them stop sitting on the floor.
Oh.
See, because of lockdown, online classes, Swati madam, on every Friday, we take this. Alternative Friday, we take on the touching the wall and touching the wall. Okay. So that is the advantage on the online classes. So gets stretched up and gets activated.
Yeah. So in the center, we have a bench. So we ask the patients to do all the exercises on the bench.
Yeah.
And I tell sir, when you're doing it, mere samne aap mat kijiye. Don't do it in front of me, because the first thing we tell the patient not to sit on the floor, not to fold your legs.
Yeah.
So that is the reason I told him he is not supposed to sit on the floor, because again he's putting a lot of pressure when he's getting up.
Yes, sir.
So there's a lot of pressure on the knee.
1 minute. So I'll end up with whatever rope has tied it. Okay.
Okay. I'm not able to see the ropes.
Oh. Yeah. This is the belt, 4 belts which are there, which are tied up. Jacket, no, madam? Sangeetha, madam?
The rope jacket. Okay, we use ropes. You're using belts, is it?
Yeah.
Okay, all right, all right. The belt has to come from a top position, sir. It has to be above the head.
It is above that.
Point where you have tied. Okay, the part of the grill where the rope is, the belt you have tied, the part of the grill, because from here it is not very clear, so I'm not very sure where is the starting point.
Yeah, the path of the grill is on the my shoulder level.
It has to be actually above the head.
It should be above that. Okay, I'll change.
It has to be above the head. Where you have tied the belt to the grill, that part should be way above the head.
Okay.
As high as possible.
Okay.
Okay, so it has to come from top.
Yeah.
I think you're trying to do the rope jacket using belts.
Yeah. Yes.
Yeah. Okay. So there are these are two ropes. So sir is not having rope, so he's using belts. And so this is the rope jacket. So he's worn the rope as though he's wearing a jacket. How do we wear a jacket? We put our right hand, we put our left hand and right hand into a jacket. So he's just got into the rope by putting the. That is why this is called a rope jacket. And this is L shape of the hands. And sir, you have to come away as much as you can. So the body has to be straight, and this helps in retraction of the scapula. This particular position helps in retraction of the scapula. There are three positions here. One is the rope is tied at the shoulder joint, the first 3 minutes. The next 3 minutes, we help slide the rope and it comes onto the elbow.
Yeah.
At this part, it comes. For that, sir, you don't do it now because you will need someone to help you with that.
Yeah.
So the ropes come at the elbow level. So this further helps in retraction of the scapula. And finally, the patient has to take it at the wrist joint.
At the elbow level.
The hand is taken behind. The hand is taken behind completely.
Yeah.
Behind. So take the hands behind. Straighten the hands. So this is the second position where the belts are at the elbow. And third position, so please take your hands behind.
Yeah.
Hands behind. No. Straighten your elbow. Straighten your hand. Straighten at the elbow.
Yeah.
Straighten your hands at the elbow, sir.
Straighten only. Yeah.
Sir, please make them straight. Make your hands straight at the elbow.
Okay, then I have to remove this rope.
Yeah. And the ropes will slide at the wrist joint.
Huh?
So you'll not be able to do it. I'm just trying to explain verbally.
Okay.
So in the third position, we slide the rope to come at the patient's wrist joint. So the hands are literally behind, they're straight. And this gives a tremendous retraction of the scapula. The third one is a little difficult, but it is the most beneficial. So these help this is for, again, with people with cervical spondylosis. So we've demonstrated the knee and also the cervical spondylosis part.
Yeah, that's good.
And it helps in retraction of the scapula. All the muscles are attached to the scapula. So it helps in retraction and it helps in ribcage expansion. And if there is kyphosis, it helps in reducing the kyphos of the patient.
Okay. Sangeetha madam, thank you. Sharma ji, welcome, sir. Sorry, thoda late ho gaya. Participants, please excuse. Yeah.
Hello, Menon ji.
Yeah.
Good evening, all. Hello, Menon ji. Hello, Sangeetha ji. Swati ji. Good to see you. Hello, Parul ji. Hello, Saraswati. Mr. Divekar.
YBN only is a very senior teacher.
I know.
Saraswati is from my batchmate in Thane School of Yoga. Shivani is from Espasa. Subramaniam is from Espasa. Yeah.
And Prakash ji, our good friend.
Acha,
नमस्कार. तुमचं हे काय तुमची जी मुस्टॅच आहे तो आहे ना एअरफोर्स अभिनंदन. नाइस. हेलो शिवानी.
थैंक यू सर.
हेलो किरण जी. गुड इवनिंग ऑल.
Good evening, sir. Good evening, sir.
Thank you, Mr. Menon, for
our Goregaon class only. Parul Desai. Yeah.
Okay. See, best thing is to experience this rope and belt therapy is I invite everyone to please come to the center. This week I cannot teach online. You don't get Menon. What is your perception?
Yeah.
After coming to session and before coming to center and after coming to sensor.
Yeah. Before
What is your perception?
before coming to center, there was a slight pain in the knee. Okay, which was
No. About rope and belt therapy concept.
concepts are very good. The
Ah.
has been explained it by Sangeetha madam.
I'm inviting all these teachers, those who are in this meeting, कि आपको जब भी time हो, whenever you have time, you fix up the day. 2-3 people can come, all can come. You come one day, spend some time, see what work we are doing. You can do some practices, apply the belt on yourself, and then you can experience what is this rope and belt therapy. Only with online session will be not a good justice to the topic. Correct? So whenever Menon is your captain, Mr. Menon, so whenever you are available or whenever you wish, you let me know. Me, myself will be there, Sangeetha will be there, Sangeetha ji, and we will also invite other teachers who are helping us. So we will help to give you a practical experience of what this rope and belt therapy is all about. See, basically it includes two type of practices. One practices we call at-home program. At-home program is the classical yoga practices which patient or student has to do at home. Correct? So it includes the selected group of practices which are beneficial in that specific condition. Whether that condition is cervical spondylosis, whether that condition is low back pain, or whether that condition is the osteoarthritis. The home care program is again divided in part 1 and part 2. Part 1 are the stretchings and part 2 are the strengthening practices. So this is the at home, and the rope and belt therapy, the specific practices which just now Sangeetha ji explained you on Mr. Menon, that is the typical rope and classical rope and belt therapy. So until and unless you don't experience, you won't get full idea. So as per your convenience, you can visit from Goregaon anytime. We have a center in Borivali. We are working morning, evening, both the times. So let us know what time you are coming and you are experienced. That is the best way. I cannot explain you what is rope and belt therapy just in online session by just one giving you some idea. Until and unless you, as being a yoga teacher, you don't go through your personal experience, you won't come to know. If you have any specific questions, you can ask me.
Swati, Parul. Swati, Swati Yoshi, Parul.
Yes, sir. Whatever the slides were shown, osteoarthritis, knee and all, it was really, really very impressive. And I really see a difference in Menon's posture and everything. So in such a short duration, I can see his kyphosis getting cured in such a nice manner. The way he's standing, you can make that out. So Ghanshayam ji, I think it is a fantastic, must be a fantastic manner that you must be conducting it. I just want to give a short, just give us a synopsis sort of thing that what did you do with Balram sir regarding his kyphosis? What was the entire idea and how did you proceed about it? Just give us a glimpse of that.
See, opposite is the therapy. Patanjali says Pratipaksha Bhavanam. Pratipaksha Bhavanam means opposite is the therapy. Kyphosis is very common in old people because of the weakness of the muscles. So you remember, if you have any student who is 50 plus, make sure you are giving backward bendings. Backward bending, either Bhujangasan, either Dhanurasan, either Naukasan, either Ushrasan, whatever possible. Backward bending is the treatment therapy for kyphosis. Correct? Same kyphotic movement, that backward bending movement, we convert through the rope and belt therapy. As just now Sangeetha ji explained you a rope jacket. So rope jacket, basically what, imagine you are doing Bhujangasan in standing position. Correct? So that is, and that you do with support, with the belt support or with the rope support. So it becomes a rope jacket. But otherwise, if you call, imagine you are doing Bhujangasana in the standing support. So you see the posture and then you create the opposite effect, opposite angle. And that work as a therapy in yoga therapy also, and as well as in rope and belt therapy. So what we do, we correct the postures, we stretch the area and we strengthen the muscles. So all three concepts work together. So correction through the rope and belt, strengthening and stretching through the home care program. So in this way, if you combine all three together, followed by relaxation and breathing exercises. So when you combine these 4 modules together, you get a wonderful effect. And that is what we are doing with Mr. Mananji.
Yeah, I practice at also.
So Parulji, where do you stay?
I would like to add one thing.
I stayed Goregaon, sir. Goregaon Western Express. I'm wanting to, and I'm really impressed today.
Please come. When you come, you will get the idea.
I feel I am opportunity. This is a great opportunity that Balram sir has thrown in my lap.
Sangeetha ji, boliye.
Yeah, actually, so we've spoken about all that. So there are also the belts, because I think we could see sir's mobilizer belts. So similarly, there are belts that a patient has to wear at home. So for cervical, there is a belt that a person can wear throughout the day, which will, because they come to the center, we are giving ropes and belts. So it is just, in that 1 hour they're doing it. But throughout the day, the patients are given belts and they are taught how to wear the belt on their own. And the belt keeps the correction in process throughout the day.
Correct. What Sangeetha ji is saying is absolutely right. Certain corrections we do for sustained period with the help of belts. So same belt we apply on the knee stabilizer, mobilizer, and also we call BSD, the scarf stretch we call BSD. So that is why they have a prolonged effect. Okay, so this is what in rope and belt therapy what we do.
Swati, any question? Swati Yoshi?
सर एक्चुअली जब जाके देखेंगे तब उसमें और ज्यादा आइडिया आएगा.
पारुल जी, ये सब आप लोग मिलके एक दिन डिसाइड कीजिए और आइए, हमसे मिलना भी हो जाएगा.
Yes, sir.
और आपको
I just wanted to ask one thing. सर आपके पोस्चर में बलराम सर, आपके उनके जो पोस्चर में अभी जो थोड़ा सा मुझे डिफरेंस दिख रहा है, so I think he is going to breathe better. Am I right?
Correct. When posture, kyphotic posture improves, your breathing automatically improves.
Because I can see the angle is also a little bit better than the previous. The way he was like stooping on one side.
और अभी तो ऐसा हो रहा है पारुल जी, he is not coming regularly because of the corona.
COVID. Yeah.
If he comes regularly, you can see the tremendous change. अभी तो he has come hardly 3 or 4 sittings he has come.
I'm so grateful, really, Ghanshayam ji, because this has been a tremendous change in his life. Really, I feel that. It's fantastic.
His family is not allowing him to come.
So after so many days, Swati, we meet in the class every day. So Swati may not find such changes. Okay.
I'm seeing him after such a long time.
Yeah.
सर और क्या एलिमेंट्स है ये 3 छोड़ के, मतलब काइफोसिस है, नी और
फ्रोजन शोल्डर, फ्रोजन शोल्डर, दैट इज में उसमें भी अच्छा. और फोर्थ है एंकिलोजिंग स्पॉन्डिलाइटिस.
व्हाट इज दैट?
एंकिलोजिंग स्पॉन्डिलाइटिस, बाम्बू स्पाइन जिसको बोलते हैं ना, बाम्बू स्पाइन.
ओके, हां.
So that is the 5th condition.
Okay.
But these conditions, Swati ji, are very common.
Yeah.
आपको नी पेन बहुत कॉमन मिलेगा, बैक पेन बहुत कॉमन मिलेगा, नेक पेन बहुत कॉमन मिलेगा, अर्थराइटिस बहुत कॉमन मिलेगा, फ्रोजन शोल्डर बहुत कॉमन मिलेगा.
आजकल बहुत कॉमन. और स्पेशली ये कोविड के बाद फ्रोजन शोल्डर्स के इंजेक्शन ये जो लेते हैं ना, इंजेक्शन लेते हैं, तो उसके बाद बहुत केसेस आए हैं फ्रोजन शोल्डर के.
करेक्ट. और स्पेशली आप समझिए कि जिसको डायबिटीज है ना, out of 10 diabetic people, 6 or 7 diabetic people will get frozen shoulder.
Oh.
It is a
What is the
very
reason?
reason even medical science don't know.
Oh,
But frozen shoulder is very common in people with diabetes. Very,
so
very common.
there is no physiological, like you must have arrived to some conclusion, some connection between that.
There is no direct connection.
Oh, okay.
But otherwise, there is some pathology happens in diabetes. And because of that, the frozen shoulder, आप किसी को भी frozen shoulder हुआ है, उसको पहला क्वेश्चन पूछिए, आपको डायबिटीज है क्या? 10 में से 7 लोग बोलेंगे है.
Okay.
बाम्बू स्पाइन में भी इफेक्टिव हो गया क्या ये बेल्ट थेरेपी?
Yeah, very good effect.
अच्छा.
Or second है, other condition which is very common is the pain in the calf area. That is also very common. तो जहाँ पे ये बताया था calf stretch, so that is also very good indication for the pain in the lower legs.
सर उनके ऊपर कितना इफेक्ट होता है? लेकिन बाम्बू स्पाइन में जो होता है, आई हैव सीन पीपल आर सफरिंग्स बहुत ज्यादा होते हैं उनमें, लेकिन ये थेरेपी के बाद कितना इफेक्ट हुआ कि उनके एक्टिविटीज में?
70 to 80% quality of life improves.
Fantastic, sir, fantastic.
I have handled a patient of ankylosing spondylitis, and I think that she used to come for many months together, and she was a very young patient, and she was detected with the HLA-B27 gene, and she used to come for therapy. And with consultation of Dr. Vinitha Ketkar, she had a specific sequence in what has to be given. And there was a time when this young lady, she was a working woman, and she had to take off from the therapy. She had some other work, and she missed the sessions for some 3-4 days. And then she came back and to me, she said, I'm very breathless. I need the therapy every day. I'm very breathless. So this therapy was her lifeline. The therapy was her lifeline because with that, she was able to breathe. Without the therapy, she was breathless. So it was a combination of, different postures that was tailor-made for a particular condition. And she was literally dependent on this therapy, even for being, breathing normally. So for ankylosing spondylitis, this therapy is a lifesaver.
But you find change in me? Find change in my back?
Yes.
बाकी तो हर रोज मिलता है, लेकिन you
आप थोड़ा पीछे जाओ सर, go behind a bit so we can observe you fully.
अरे you are younger person man. दिन ब दिन आप younger होते जा रहे हैं सर.
क्या बात करो ना, postural changes you find.
अरे you are young man यार. आप तो देवानंद हो, देवानंद.
Saraswati, yeah, any difficulty? She is also a yoga teacher. She is from Thane School of Yoga. We have done therapy course together. Sir, yeah.
Very good.
Sir, after seeing your Tadasana post, I was very surprised. Ma'am, Sangeetha ma'am told you to do the Tadasana, no?
Yeah.
I was very surprised because your Tadasana used to never be like that. So that's how I came to know the effectiveness of that.
No, you want to ask anything difficulty about this therapy? What concepts of the therapy? Please ask.
Sir, this explanation was quite very good, clear, especially for that. She said for that cervical, which she said, no, because I too have many patients who are having similar conditions like that. Yeah, so I used to just give them modified backward bends. That's it. At the most, I used to tell them, use a rope and tie it to the window and keep the leg raised like that. Those kind of things I used to give. But I never knew these are very effective methods.
Saraswati ji, where do you stay?
I stay in Navi Mumbai, sir, Nerul.
Acha, little far away. Correct. Otherwise, you could come sometime to our center and see what work we are doing.
Surely, sir, I'm very much interested. I'll come one of these weekends. I can come. Weekdays, it's not possible for me.
We can let us know in advance, so accordingly we will do the arrangement for you.
Yes, Sunday also some arrangement can be done.
Yeah.
Let us
Actually, in this session, I think people have just been exposed to 5 to 10% of what the therapy is about. So whatever you've seen is just a small, it's a preview.
You come one day, you experience yourself. We will give you certain rope and belt therapy on your body. You see, I traveled Pune to this Gnosis Medical Center, Medical Yoga, where Dr. Vinita Ketkar Center is there. And it was my taxi drive for 4 hours. So there was no back pain. But she just told me that take one lumbar traction. But even after taking lumbar traction, I felt so nice in my back. There was no pain, but then a good feeling came after this thing. You feel that there was some unnoticeable stiffness in the back which went away. So this is how rope and belt therapy work.
It really works like a miracle, sir.
Yeah, it is wonderful with all the efforts, with lot of lot of support from Gnosis and lot of support from Vinita Ketkar. We were able to start the rope and belt therapy center in Mumbai.
Okay.
So we want this maximum information should go to yoga teachers, and maximum yoga teachers should take benefit of this.
Sir, is Dr. Vinita Ketkar accepting new students? The course is starting tomorrow. She's still accepting new students.
Who is interested to join?
No, I am just asking just as a thing.
Only from tomorrow. Tomorrow she will accept.
Okay.
If anybody is coming tomorrow, then accept, but not after tomorrow.
After tomorrow, okay.
Shivani from Espresso, you want to ask anything?
Sir, I was just listening to all these things. It's a new topic to me, and I'm highly impressed by how this rope belt therapy is working to cure all these problems. But I would not be able to visit Pune because I am here in Delhi.
Yeah, that is okay. That is this is aware. So, Espresso students, what is a rope belt therapy?
But Shivani ji.
Yes, sir.
There is one Dr. Sachdeva from Delhi. Dr. Sachdeva from Delhi. He is doing the same therapy, same concept, similar concept in Delhi.
Share his number. She will talk to you.
So one doctor is there. Because I saw his website, same Dr. Karandikar, he has put his guru, Dr. Karandikar, who is the real, you can say, he invented the application of rope and belt therapy.
Yes,
and
sir.
Dr. Srikant Karandikar is also a guru of Dr. Vinita Ketkar.
Yes, sir.
So you can visit the Sachdeva's Medical Yoga Center based at Delhi.
Okay, sir. Okay, sir.
You can see his website.
Okay, sir.
Sir, website will be available.
Yeah.
Okay, sir. Thank you, sir.
Okay, Menon ji, chalo.
Yes.
My role is over.
Taking a valuable time, Sangeetha.
Yeah, thank you so much.
Okay, chalo, all are welcome.
Thank you, sir. Thank you so much.
Nice to see you, Swati ji and
yes.
Prakash ji.
Same here, sir.
Thank you.
बहुत दिन के बाद देखा.
Thank you, everybody.
Thank you so much.
Thank you, Sangeetha ma'am.
Thank you, sir. Okay. Bye.
Thank you.
पारुल, बहुत अच्छा लगा आपको भी देख के बहुत दिन के बाद. Thank you, madam. Thank you, Sangeetha.